we welcome you to this very special Health Wagon Impact event. It seems like only yesterday that we were trying to get the dirt moved and then get the building built and get the parking lot paved. We certainly welcome you to this effort to introduce those gathered here and others who might be watching to the Health Wagon. I'm going to ask Sister Bernie Kinney, if she would please, the founder of the Health Wagon, to come and offer a prayer. Sister Bernie. And if we would all stand, please, as Sister Bernie offers the prayer.
Good and gracious God, we give you thanks for the love of these people and the love you have put in our hearts, the love which binds us together and gives us the energy to be about helping create your kingdom of love, peace, and beauty. Bless our time together, and may it be fruitful in your eyes, and bless these fine people who are dedicated to you. In Jesus' name, amen.
Amen.
Thank you, Sister Bernie, and you may be seated, please. We thank you, Sister Bernie, for your continued inspiration to this entire community and for all that you do. We would now like to introduce Dr. Teresa Gardner, the Executive Director of the Health Wagon, to briefly explain the reasons for the Health Wagon. Teresa.
Thank you, Shane. We appreciate everybody's time and effort to come out and be with us tonight, and your commitment to being here with us. We are so blessed to have you a part of this. And the reason for this is we want to inform people about the services of the Health Wagon and what we offer. Okay. The mission of the Health Wagon is to provide compassionate, quality health care to the medically underserved people here in the mountains of Appalachia. Sister Bernie Kinney, she actually started this mission over 30 years ago, literally out of the back of a Volkswagen Beetle that our board president, Larry Kennedy, he recalls a story about how he used to fix it up, and it would need repairs, and he would fix it up every weekend and get it going again for the weekend, and that's how she started out. And then she eventually secured some mobile units down through the years, and that's how it all began. She came here at the request of the Richmond Catholic Diocese. We feel that she had a very innovative model of health care. Currently, we have 2 mobile units and 2 stationary clinics, a stationary site here at Wise, our new clinic here at Wise, and then we have our base is out of Clintwood, and like I said, we have the 2 mobile units. We provide dedicated care at 10 sites, and we're in Dickinson, Buchanan, Russell, Scott, and Wise counties, and we're on a weekly, bi-weekly basis. Some of the sites we rotate in and out. Everything we do here is essentially free of charge. We do have a small copay if the patients can afford that. That's $10, and $4 for the prescription medications. And so we encourage donations for our patients. But if patients do not have the ability to pay, then they're not forced to pay. We feel that we're very innovative in that we have a nurse-managed clinic. And with this, we use generic drugs when possible. We rely on our clinicians' diagnostic abilities and holistic care. We provide very holistic care here. And we feel that we have unprecedented collaboration with multiple entities here. Our service area, the terrain here, as many of you know, is very mountainous, and we have numerous locations being geographically isolated from others. And so what this translates when it means to care is that patients cannot access care. There's lack of adequate transportation here, and they simply cannot access basic health care needs. This is some of our patient demographics for 2012. We had 215 clinics, and we're the medical home to approximately 2,500 active patients. And last year we seen 4,591, that was our patient encounters, and 212 telemedicine consults. 70% of our patients live on income levels that are less than $20,000 Here in our service area, our death rates from common causes are higher in our service area than in Virginia overall. I won't read all these, but as you see, there's some pretty high numbers here. 46% more likely to die from chronic obstructive pulmonary disease, and that comes from the smoking that's inherent in the area, and the coal miners' pneumoconiosis or black lung. 47% more likely to die from pneumonia or influenza, and 34% more likely to die from diabetes. We see so much diabetes. And a staggering statistic here is 72% of our people are more likely to commit suicide. So we have high prevalence of mental health issues and a lot of limited resources around that. This is a really good slide. It is from the, it's matched data from the Robert Wood Johnson Foundation, and it's looking at the relative health outcome rank as it associates with mortality and morbidity. And as you'll see, and this is out of 132 areas that they're looking at in Virginia. So as you'll see on this, Wise, Dickinson, Russell, and Buchanan are very high. And so what that translates into that there's not a lot of healthcare resources in our area. And so our mortality and morbidity rates, when you compare them to the state overall, are certainly much higher. And kind of our response to all this, and the why for the health wagon is that slide kind of sums it up. That's the reason that we do what we do, is because there is so much healthcare disparity in our region. Components of our healthcare outreach include acute disease management and chronic disease management. We see a lot of diabetes, a lot of hypertension, coronary artery disease. We are able to offer low-cost labs. You can get like a cholesterol for $4. We have a wonderful medication assistance program called the Pharmacy Connect. And last year alone, we ordered over $1 million worth in medications with that program alone. Telemedicine, we're able to connect with UVA at Charlottesville, UVA Health System there, and we provide more telemedicine than anybody in the state of Virginia. And so what this means to our patients is that they can access some of the best specialists in the country, all without leaving even their community. And another wonderful aspect of this is that if a patient does not have insurance, then it's all paid. Their visit is paid in full by a grant from Anthem. We do a lot of psychology over this. We get the patients in with psychiatrists. We use it a lot for mental health issues. We've used it for cardiology, nephrology. We use it a lot for dermatology. Paula and I have been trained on colposcopy, and we're having our first colposcopy clinic next month, which we will. This is when a woman has an abnormal pap smear. We'll be able to go in and do a biopsy, and all this will be done over telemedicine. We also had our first ostomy telemedicine clinic, and this was the first in the nation. So the patients that had a procedure where they were left with an ostomy, they were able to come here to our clinic without having to travel 6 hours back to Charlottesville. We're very proud of this. We have a very strong immunization program. We do hundreds and hundreds of flu immunizations every year. We have a wonderful referral and follow-up system in place because, you know, we detect a lot of disease burden, and then we have to get these patients in with appropriate referral and follow-up. We have various specialists that come in, and we hold specialty clinics such as cardiac, pulmonology, as I was saying, colposcopy and ostomy and nephrology clinics. So we try to bring specialists into the area. Endocrinology is a very important clinic that we do with Mountain States Health Alliance with Dr. Reinhardt. We have Dr. Smitty. He comes. He is a pulmonologist or a lung specialist. He will come and do clinics for us about every 3 to 4 weeks. Just at his last visit here, he diagnosed a aortic aneurysm on the chest X-ray, and literally that clinic last week saved a patient's life. He's seen that on the chest X-ray, and we got her in for a surgical consult right away. We've got Dr. Ross Isaacs. He's a nephrologist. He will come and do clinics for us to check on the patients with chronic kidney disease and so forth. And there's other things that we have here. We've got a really strong women's health focus with pap smear, and we have mobile mammography with UVA Health Systems at Charlottesville. We do digital mammograms. And we do have like a long closet for medical supplies, and we're reaching out to start to do some eye and dental services, and those are kind of limited right now, but hoping to expand those in the near future. Probably the thing that we're most proud of is our remote area medical health expedition. In addition to the Health Wagon's regular rotation, the Health Wagon spearheads the annual remote area medical health expedition with a lot of wonderful community partners. We have really just been blessed. To us, this is a modern day miracle, as with the little boy and loaves of bread in the days of Jesus. This is just efforts multiplied that really culminate in a modern day miracle. If you've ever been there, you know what we're talking about. But we hold this annually at the Wise County Fairgrounds in the summer of each year. We just finished our 14th event, and we do this with a host of volunteer physicians, nurse practitioners, nurses, opticians, ophthalmologists, dental hygienists, and so forth, and a lot of lay support. Our primary focus is on eye, dental, and medical care. This year alone, we had 4,955 patient encounters and delivered $2.3 million worth of free care, and with over 1,400 volunteers. And you'll just see some really wonderful pictures here of the Remote Area Medical Health Expedition in full swing. Here's some dental pictures, and we'll have like 75 plus dental chairs in operation at this event. And we've just been so blessed with an outpouring of the community for all that we've been involved in. It's just a monumental event, and we really owe the success of the community first and foremost to God, who blesses us with all these wonderful partners. But we just got so many people that join in our efforts, and they're compassionate, and we cannot say enough about the wonderful volunteers in the community support that we receive. The very last picture is in 2012. We opened a new 5,000 square foot facility here in Wise, and it was donated from land with the Industrial Development Authority with a large charitable gift from a donor. And we were able to have UVA Health Systems. They installed a new telemedicine site here. We have now 6 exam rooms and space for administrative offices that have been very valuable, and we hold a lot of our specialty clinics here. But certainly the need for funding continues. A lot of people ask us, about the Affordable Care Act, and we see the Affordable Care Act as a lot of our patients are still not going to have access to health insurance. As we understand it, a lot of the patients are going to be forced to pay from anywhere from $1,500 to $2,000 in premiums a year, and that is not taking into account the co-pays and deductibles for a single family, for one individual, their co-pays will be level off at about $6,700, and a family of 4 may see co-pays to go to over $12,000 a year. So a lot of our patients are working poor, and they will not have the means to pick up these health care premiums and pay the deductibles. If they could afford health care insurance, they would have it now, but they simply cannot afford it. A lot of our patients are paycheck to paycheck. A lot of them have had insurance all their lives. We're seeing so much of that with the coal mine and layoffs. They've had insurance all their lives, and they're to a point now where they've lost that health insurance. And so it's very sad with the economy the way it is right now. And with the Affordable Care Act, Virginia is still not decided, and so all that isn't really in a state of flux in the state of Virginia. But essentially, I think bottom line is a lot of our patients are still not going to be able to have access to health care, and so the donations are ever more important for us. For the first time ever, we've got a waiting list for patients to get patients into the clinic, and it's just really bothers us at the heart level, because we've never had to really turn patients away, but the need is so profound now. So we thank you for your time, and we thank you for being here, and thank you for allowing us to share some of the healthcare outreach initiatives of the Health Wagon with you.
Thank you, Teresa. Teresa, I believe it is your desire that right now we hear from 3 of your patients. Is that correct? Yes. And we're going to ask you, please, if you would come forth in this order and let those gathered know about the services that the Health Wagon provides to you. Francis Adams, please. Okay.
Yes, I would like to say that the Health Wagon has been a tremendous help to me and my family. And starting off with with Sister Bernie, she took care of my mom for years and years with the health wagon, because she had cancer, and she did pass away though. But that was one big help that the health wagon gave to my mom, my family, and they have helped me um, through so many things. And I know I had problems with cancer. Well, they said it was cancer, but when I got to when Teresa and them did all the testing and stuff on the health wagon on the bus, and found out that I did not have. They sent me, and I got all these tests and things done. And thank God it wasn't cancer, but there were so many other things that they helped me with. And I had high blood pressure and I didn't know it. And they helped me with that, because that was the one time I could have had a stroke, they said, because my blood pressure got so high. I did not have insurance. And so I would come, to them. And then they have helped me with the dental at Ram. And I had root canals done. I've had so many tests done through the health wagon, and I'm blessed that I was able to get that help. And like I said, so many people that I do know over on Dixon County side that has really been to the health wagon. They have really helped people, in certain ways and areas, so that they didn't even realize that the health wagon was there for them. So I'm thankful today that Teresa and Paula, Sister Bernie, has really helped me over the years. Now, not just a year or two, but for years since that health wagon started. 30 years ago, Sister Bernie was there for me and my family. And still Teresa and Paula, I come here a lot, and they have really helped me and my family. Amber, they found out that she had cerebral palsy. Yeah, she about had a stroke. And they are still helping her with that, sending her down to Virginia, the state of Charlotte, down there to get help. So, like I said, it's really been a help, and I am all for the health wagon in Southwest Virginia. And I just pray to God that we keep that health wagon and keep our workers in the name of Jesus. And I thank you all. Amen. Amen.
Thank you, Francis. And now we're going to hear from Shallon Payne. Shallon?
Good evening. When David first contacted me and asked if I would like to address you all this evening for a few minutes, my first thought was, a few minutes is a terribly long time to have to talk to a group of people I don't really know. But it has occurred to me since that a few minutes is not enough to tell you all that the Health Wagon has done for our area. There are so many things that I could say about Teresa and Paula and Dr. Smitty and their team. They're just a wonderful group of people. Most of you all don't know me, so I'll introduce myself. My name is Shallon Payne. My husband Mark and I live here in Wise. A few of you probably do know Mark, and if you don't, then you certainly know his mother Joyce, who was the executive director of the Chamber of Commerce for many years. Mark, my husband, was a manager at Verizon for 22 years. In 2009, he retired, and he decided to begin a second career in law enforcement of all things. For 3 years, he worked with the local town police force, and this April, he surprised me. He decided to go and work for Wise County Sheriff's Office. After accepting this position, we learned that for 30 days we would have no health insurance coverage. 30 days. That doesn't seem to be that long, does it? Our insurance ended at midnight on the last day of April. On the first day of May, my daughter fell and injured herself. Less than 24 hours after losing our health care coverage, I was faced with a medical emergency, not with my health, but with my child's health. I already knew Paula and Teresa, and I knew the health wagon, and so I knew that they could and they would help me, and they did. They became my personal heroes that day. Days passed, and our lives returned back to normal. And then one afternoon, not far afterwards, I received a phone call confirming, "Will you be at your neurologist appointment tomorrow?" And on the phone, at that moment, I had to decide, how much is my health worth? Fortunately for me, I, unlike most others without health insurance, had the financial means to pay out of pocket. So I kept my appointment. While seeing Dr. Kershaw, he decided that it was necessary that I have an MRI with and without contrast, an MRA, and a blink reflex test to rule out MS and a brain tumor. So once again, faced with thousands of dollars in medical testing, I had to decide, how much is my health worth? I asked the doctor how urgent it was that I had these tests. I had 24 days left yet before I had health insurance again. Fortunately, he decided that it could wait 24 days because even in the worst case scenario, even if it were a brain tumor or MS, 24 days would not make and they give help. They give. They give from their abundance of love for others and from their sincere desire to meet people where they are and to bring to them the most basic necessity. They bring them health care. They are amply fulfilling Sister Bernie Kennedy's vision to take health care to people who otherwise would not have any. People like me last May, and people unlike any that you or I have ever known. People living in the most destitute situations. They go showing no prejudice, no judgment, asking no questions, simply reaching out because they are able, and they are able because of the generous donations of people both within and outside of this great community that we call home. Thank you.
Shallon, if you speak that well before people you don't know, I would love to hear you before people you are familiar with. I had the opportunity to talk to Shallon one afternoon, and she shared with me how her service with the Wise Ram, how being a Spanish-speaking person who learned her Spanish at UVA Wise, she was able to see that a young man who was going to lose his foot would have lost his foot from surgery without her assistance. Thank you so much. You paid back. You paid back.
14 to 16 days.
Can we imagine the number of people now who, not by choice, who've had health insurance for decades, hardworking men and women employed in the coal industry, who maybe tomorrow will face the same thing that Shallon spoke of. No health insurance, not knowing which way to turn. Jess Powers, if you would come and share your thoughts with the group, please.
Thanks, Shannon. Thank you for the opportunity to be here tonight. I've known Teresa all my life. I've not known Teresa. She lived a block away from me in the small village of Riverview outside of Coburn. She knew my mom well, and I knew her mother well. And as an emergency management coordinator, a mayor of a small town, a 10-year volunteer for the Wise and Buchanan County Remote Area Medical Expeditions, and a former emergency planner for the Virginia Department of Health in Southwest Virginia, I know there are certain and difficult challenges in health care in rural and impoverished Southwest Virginia. The unmet health care needs of individuals in Southwest Virginia are alarming, are chronic, and are severe. Poor health indicators, geographic isolation, unemployment, illiteracy, lack of transportation, and communication resources are compounded by a severe shortage of healthcare providers and an overlooked and overworked hospital network. As a result, adults over the age of 18 account for 75% of the population, with about 14% over 65 that receive Medicare. The poverty rate is much higher in Southwest Virginia than it is in the rest of Virginia. Adults aged 35 to 64 in the region die 30% sooner than the same population in the rest of Virginia. Where is the nearest trauma hospital? People say Kingsport, Bristol, Johnson City. But aren't those in another state? Where is the closest trauma hospital to Southwest Virginia? You have to go all the way to Roanoke. If it's a trauma, do you have 3 hours to wait? Over 30 years ago, the Health Wagon was founded by Sister Bernie Kinney. She came to Southwest Virginia and began dispensing health care, a hug, and a gentle touch from a Volkswagen Beetle. St. Mary's Hospital provided a valuable partnership and sponsored the program for over 25 years. I was born at St. Mary's Hospital, and without the innovative medical treatment I received when I was 6 years old, I would have surely died after my kidneys failed when I was 6 years old. Sister Bernie turned over the reins of the Health Wagon in December 2005 to Teresa Gardner, who has been with the health department for over 18 years. The Health Wagon is a must for Wise County and Southwest Virginia. I would like to extend my sincerest gratitude to the Health Wagon and their group of volunteers who donate their time, talent, and expertise to helping Southwest Virginia residents find quality medical care. Founded by a group of volunteers many years ago, the Health Wagon continues to rely heavily on volunteers and donations to increase its capacity to serve the medically underserved year after year. The Health Wagon contributes in direct patient care as well as in administrative roles in bringing the remote area medical expedition to Wise and Buchanan counties. The medical staff sacrifices their time and efforts to help the needy, the unemployed, the uninsured, and those living on fixed incomes. These extraordinary efforts cannot be applauded too much, but I do applaud you every day for what you do for our area. When it comes to the RAM, the morning after the RAM event, the Health Wagon starts preparing for the next RAM event. And it starts a whole year ahead of time. And it's not, I'll work on it 15 minutes today or 15 minutes tomorrow. It's a full-time job starting the day after the RAM. Many start showing up days before the RAM event in Wise. On a Thursday summer afternoon, the line starts forming. Thousands wait in line for the gates to open at 5 a.m. on Friday morning in the pre-dawn darkness. Many walk through the night to get there to the RAM, some as many as 15 miles. They're in line because their teeth needs to be fixed, they can't hear, they can't see, or they have felt for so long they need assistance. For this weekend, the fairgrounds have been turned into a one-stop shopping outdoor medical clinic. With the help of the Health Wagon, once again, the remote area medical has arrived for its annual visit to Wise, bringing free dental, vision, and medical care to Southwest Virginia. In the words of the Rounds patients for the Health Wagon, because of you, I have hope. Because of you, I am getting better. Because of you, I do not feel pain anymore. Because of you, I can now work and support my family. Because of you, I can give thanks. Because of you, this little girl said, with the glasses, I can see my mother's face for the first time. Because of you, I can live to help take care of my grandkids because my children are in jail and I'm the only support that my grandkids have. Not enough can be said about the great need and appreciation for the services provided by the Health Wagon. And another little boy, he was 8 years old. He was in so much pain because of the cavities in his teeth. He started crying as the doctor was giving him the shot to numb his teeth. And the doctor said, "Am I hurting you?" He held the doctor's hand and said, "It doesn't hurt as much as my teeth hurt." So those are the kind of services that we bring. And not only my own son, he decided to quit school, run around Germany for a while. It took me tens of thousands of dollars to bring him home. And when I got him home, he had an abscessed tooth. He was not covered under my medical insurance. And I had no more money to give him because I spent everything I had to bring him home. But when he sat through the line and he received the services to get his abscessed tooth filled, he said, "Dad, that was the best dentist I have ever been to in my life." So the quality of care is here, and it's to the great benefit that we have the Health Wagon here to make sure that we do have those services provided. The Health Wagon continues to strive to meet the challenges of health care to the medically underserved and poverty-stricken areas of rural Southwest Virginia. Through the use of this innovative facility that we now are in today and the mobile health unit, healthcare doors are opened to many needy individuals, families, and communities, doors that would have never opened. The Health Wagon visits communities in Southwest Virginia on a regular basis, providing primary health care services. The Health Wagon emphasizes education and prevention, which is considered the key to improving the health in Southwest Virginia. Teresa, Paula, the team of volunteers that you have and the employees of the Health Wagon, I appreciate and thank you every day. Thank you.
And now you can see why Teresa, Paula, Sister Bernie, and I have had to have very little to say, because it's these people that you need to hear from. Francis, Shallon, and Jess, we thank you so very much for your testimonies as I look out and I see people who have truly affected the possibility of the Health Wagon being here today. I'll not mention names as I look across the room and see so many faces. It's nice to know and to hear firsthand how the Health Wagon has impacted the lives of so many families. At this time, without even having to ask her to stand, for it's her nature, she's already standing, I'd like to introduce you to Dr. Paula Mead, the clinical director. And what we're going to do, I'm going to ask that half of you, and I want to ask these first two rows, the two back rows we'll call them, to go with Paula, and she's going to take you on a tour of the facility, while the rest of us in the room will watch a DVD of ABC's Nightline program on the Ram Clinic. And then once you return, we will go on a tour, and the rest of you can see the DVD of the clinic. So if you want to go, if you haven't been through the tour, you're welcome to go. If not, you're welcome to please stay and see the Nightline DVD. If you didn't have a chance to see it, and you might not have stayed up that late, it is truly touching, it is truly accurate, and it paints a picture that needs to be painted. So if you haven't had a tour of the facility, I'm going to ask any of you who'd like, by show of hands, to follow Paula and go on a tour of the facility.
Y'all want to come this way with me?
Anyone who wants to follow Paula, please. And then once again, I'm going to turn it over to Teresa who is going to introduce us to the ABC Nightline's Wise Realm 15-minute DVD. Please, Teresa.
Okay, we will get the video going. This was Nightline, and Bob Woodward was with us. We were blessed to have him with us, and they spent about the entire weekend with us, and we think that they did a phenomenal job covering this year's event.
We're going to take you to an astonishing annual event in a remote part of rural Virginia. For 3 days, people come from all around for a free clinic providing medical aid they couldn't otherwise afford. In a coal mining economy hit hard by disappearing jobs, many have had to swallow their pride as they line up for basic care. They're men and women, young and old, traveling with their families or going it alone. Here's ABC's Bob Woodruff with our series, Off the Map.
It's 5 a.m. on a Friday morning. Nearly 1,500 people have been lining up for the past 24 hours in the parking lot of the Wise County Fairgrounds in Southwest Virginia.
Please show us your number.
But they aren't here for a summertime fair.
What are you doing here?
I'm coming to get my dentures.
Yeah? Oh, you got to get new dentures?
Yep.
I have knee issues. I have a 7mm hole in my knee.
I have a lot of trouble with my lungs right now, and I need to see a pulmonary specialist, so this was my only option.
This is Remote Area Medical, a traveling health clinic known as RAM.
Morning, doctor.
And this is Stan Brock.
We're heading for the gate to let people in.
For the next 3 days, Brock and a team of volunteers will turn this fairground into a makeshift hospital, providing medical care to more than 2,500 people.
People are showing up.
And Nightline was invited along to watch.
It's always an amazing sight, isn't it? That here in America, at 5 o'clock in the morning, with rain threatening, there's 1,500 people out there.
This is Hayden, and this is Jaden.
Towards the front of the line, the Harani family is waiting. The early hour is trying the twins' patience.
That's enough.
This is the second year they've come.
That's the family. What are you looking for? For dental, for vision? Or, so they haven't any kind of dental?
They do, but what they have doesn't cover enough, so we bring them up here where everybody can get it once a year.
Brian and Heather will get their teeth looked at.
I've got a couple of cavities that need to be refilled.
For their teenage daughters, their eyes.
I'm almost legally blind in my left eye. I have glasses, but I stepped on them.
What's your ticket number?
We're 101 to 110.
The lowest numbers will get in first. Those with the highest numbers could wait for days.
Oh, so you're one of the first in?
Yes.
Ah, good job.
Farther back in line, the Ramos family has spent the long night in a car.
They're gonna have their eyes checked out.
How are your eyes?
I just want to make sure they're okay. When I have a book on the desk, I'll have to lean down, or when I go to pick the book up, I'll have to put it like right here.
Why is it that you are coming here instead of going to an eye doctor or dental doctor?
Well, right now, the way the economy is, work's really hard, and, money's real tight. It's free, and the last 3 years, I've passed it up, I guess because I'm kind of prideful, but, this year I was compelled to come.
What's your number?
What was it?
11:32.
11:32.
11:32.
Mm-hmm.
All right. So it's probably going to be sometime later in the day you're going to get the full care?
They will have to wait a while.
All right, let's do it.
Just before sunrise, the Wise Virginia Ram Clinic
Good morning, folks.
officially begins.
Who's got number 1?
Within 30 minutes, the Harani family passes through the gate.
On 11.
What's the first stop? Do you have any idea what the process is?
Yeah, we got to go through this triage here.
Their vital signs are checked, blood pressure and blood sugar too. And then the family disperses, Brian and Heather to get their teeth worked on.
You're doing cleaning. You hang on to this.
The twin boys, Jaden and Hayden, go to get dental x-rays.
All right, now, bud. There you go. I got.
And then a cleaning. Both twins get a clean bill of dental health.
Okay, you super. Good job, boys.
By early afternoon, Jordan Harani is able to get in to see the eye doctor.
Is it better 1 or 2?
A change in her prescription means a trip to the eyeglass tent.
No.
And successful search for a pair of frames.
Okay. I'm solid then.
Over in the optical lab, Tom and Judy Dandridge oversee an assembly line for grinding lenses. helping people see clearly, sometimes for the very first time in years.
That's what keeps you going. You get frustrated, you get aggravated because you want to change it, you can't change it. So you just do your best, and you know, thank God that He put you here to do what you do out here.
You've got 40 or 50 million people that are in this category that don't have insurance and can't get the care that they need, or they can't afford it.
Teresa Gardner was born here and still lives here. 14 years ago, she invited Ram to hold a clinic here, and sadly, it just keeps growing every year.
There were people out there with wheelchairs waiting to get in. They slept in that field overnight in their cars.
Right.
That's pretty remarkable.
We actually see them lining up days in advance for this event. We sure do, and it's just incredible the desperation that people have for health care in this country, because health care is just is so expensive.
Does that anger you?
I don't know. I don't have time much to get, I guess, angry about it.
Ram couldn't pull this off without the 1,400 volunteers who donate their time, expertise, and compassion. People like Anna Rollins, who's been coming here since she was 8.
How did you start being involved with this?
I just started doing statistical work, and eventually I moved up to being an assistant, and now I'm looking to go to hygiene school.
So all this has influenced what you're going to do for your career?
Yes.
And remember that gentleman who was hoping to get dentures after 24 hours of waiting?
Well, please.
Do you recognize yourself in that mirror?
No.
He has volunteer dentist Scott Miller to thank.
It's awesome, man. I mean, that's the only thing I can do that I can change somebody's life like that. It's awesome. It's rewarding. That's what brings me back every year.
Yeah, well, nice to see you.
I even run into a Navy nurse who was working at the Bethesda Naval Hospital 7 years ago when I was there, recovering from injuries sustained from an IED in Iraq.
One of the guys that saved my life. Nobody better than you guys for this. Okay? More insurance than anybody else.
By the end of the first day, some 1,200 patients have been seen. How was the day?
It went really well. You know, they gave me a lot of encouragement on what I can do next for my specific problems.
I'll see you in a minute.
Jordan has picked up her new glasses. Her twin brothers, teeth clean, have stopped squabbling.
How are your teeth? Let me see them. Ouch. Let me see. So they look pretty good. They look better than last time.
We wasn't expecting it to be this good as far as the friendly people and all the volunteers and the help and stuff like that. So it's pretty good.
So we'll definitely be back every year.
But even with all the volunteers, dental chairs, and good intentions, as the day winds down, not everyone has been seen.
Good morning, folks.
Which means that the next day begins with people like the Ramos family, coming back for a second day.
Only thing we got done was standing in line, paperwork done, and we got our bands.
And hundreds of new people arrive, including one man who walked through the night to reach the clinic.
I really need my teeth fixed. They're really bad. And my hearing, I don't know which one's worse, my hearing or my teeth.
When Robert Ellis goes through triage.
He said he's had some pain in his chest when he was walking up here this morning.
Something potentially more serious is uncovered.
There's no shortness of breath involved.
When we come back, we follow Ellis to see the heart doctor as hundreds more continue to wait for treatment. It's day 2 at Remote Area Medical.
An out-of-the-way part of rural Virginia, an annual 3-day event brings people from far and wide for free medical care they urgently need. It's a completely volunteer operation of people who treat thousands in need, and sadly, the demand is growing every year. Here again is ABC's Bob Woodruff.
Wise, Virginia is a coal mining county, far from any major airport. Stan Brock flew in from Knoxville, where Ram is based.
Lonesome Pine Airport, 10 miles.
Ram has done just over 700 expeditions, as Brock calls the clinics, since 1985. This idea came to him when he was injured on a cattle ranch in the Amazon, 26 days on foot from the nearest doctor. To help others,
Line 6.
He brought medical teams to other undeveloped countries like India, Haiti. But what Brock quickly learned was that there was desperation in the U.S. as well, especially in places like Wise, where jobs have disappeared and few doctors hang their shingles.
It's their sort of one-time opportunity that they know they can afford to get the care that they need.
The Wise Clinic is one of the largest that they do here in the United States, serving some 2,500 people. And on the second morning, hundreds again line up in the pre-dawn darkness for a chance to see a doctor.
So the first thing we're going to do is bring in the people that were left over and waited here for what, some of them 24 hours or more.
Good morning, folks.
Among the hundreds streaming in, the Ramoses, who have now waited more than 24 hours.
Only thing we got done was standing in line, paperwork done, and we got our bands.
But suddenly, this man is moved to the front of the line. Robert Ellis has walked 15 miles through the night, walking stick in hand to get here.
I had a ride, but I didn't have enough gas to put in my truck to get here, so I told the old lady I just walked.
Even though his son just returned the day before from serving in Afghanistan, Ellis knew he had to come to Wise.
And I really need my teeth fixed. They're really bad, and my hearing, I don't know which one's worse.
But his visit to triage uncovers something else.
He said he's had some pain in his chest when he was walking up here this morning. Do you have it right now?
No, I don't have it right now.
There's no shortness of breath involved, nausea and vomiting.
Dental and hearing will have to wait as he is taken to the medical tent and cardiology.
I've been having chest pains lately. Not often. That's starting to come more often.
The clinic offers specialty areas, including cardiology, dermatology, orthopedics, even mobile x-ray units, and denture labs.
The people we're going to see here never get teeth if we don't give them to them.
About 80 dental chairs are up and running, 16 eye examination stations, 2 optical labs, grinding 600 pairs of glasses a day.
We carry about 10,000 lenses on here.
Manning it all are those volunteers.
And that is in what town?
Whose ranks have grown by one as Virginia Senator Tim Kaine slips into registration to do his part.
And how about an emergency contact, family members?
By Brock's estimation, Kaine is one of only a dozen or so politicians who have ever been to a RAM event.
People will drive for days, and then they'll get here 2 or 3 days early to camp and wait so they can get care. And this is the most powerful nation on earth. But we can do so much better.
By the afternoon, Ellis is getting his eyes checked.
I can read A. I can't tell what the bottom one is.
And pretty much everything else.
Thank you. They changed my blood pressure medicine, and I had my hearing checked. I'm gonna need hearing aids. They fit molds on both my ears, thank God. I needed that. And after I get done with this, I'm gonna go over and have my teeth pulled. I didn't think I'd get this much done today. I really didn't.
On Sunday morning, the third and final day, the crowd is much smaller.
It's a short day, and so we're bringing in really just an extra 100 people in vision and an extra 100 people in dental, and that should just about do it for the morning.
The very last of the dental patients continue to be worked on as equipment is packed up and the heavens open.
We don't need to be doing this in the world's richest country. I would rather be back in Haiti, in India, in Africa, and where this organization began in the Amazon than doing it here in the world's richest country. But I don't see this ending anytime soon.
The numbers from the weekend support the claim. Some 1,200 dental patients have been seen, 4,000 teeth pulled, 900 pairs of glasses provided. In total, over $2 million worth of health care provided, all free of charge.
It doesn't matter where you go in the United States, you're going to find these huge numbers of people that either don't have access to care because it's an underserved area, or in most cases, they simply can't afford to go to the dentist. They can't afford to go to the eye doctor. And so they're going to be relying on the kind of services that we provide.
For Nightline, I'm Bob Woodruff in Wise, Virginia.
What a remarkable effort. Our thanks to Bob Woodruff. For more about remote area medical, visit our website at abcnews.com/nightline.
We hope that you enjoyed that and found it informative. How many of you saw that for the first time? And so did I when I saw it the other day. I tried, but I missed when I knew it was scheduled to be on television. How powerful that message is. And we are reluctant to say that we might be in a situation where those numbers are going to increase in the coming years. Wise County is going to turn the corner of this downturn in the coal economy. We just don't know how long it might take us to make that turn. But in the meantime, for those of us who have health insurance, for those of us who have access to good, proper health care, we must be more thoughtful about those who don't have it and support such facilities as this. I think we're going to go ahead and invite all of those who've been on tour to come back in and have a seat so they can see the film. Any who now have not gone on tour, you're welcome to do that, or you're welcome to stay. We encourage you, though, to tour the facility so that you can see all that they are doing here.
Welcome to our Health Wagon. I am Paula Mead. I'm a family nurse practitioner and the clinical director here at the Health Wagon. We want to welcome you to our specialty clinic that's located here in Wise. This was built in 2011 and it was truly a community effort. When you come first into the building, you'll notice this is obviously our reception area. Our chairs and waiting room furniture was actually donated by Mountain States and Norton Community Hospital. We're going to give you a tour so you can kind of know what we have available here. On the walls as we go through, if you'll look, we have tried to put inspirational verses because we are a faith-based organization. We are a free clinic. We accept donations of a $10 fee, which is actually an administrative fee that allows the patient to participate and also gives back to us here at the Health Wagon to help with some of our cost. We are funded primarily through private donations, through grants, and we're coming off of one large HRSA grant, which is a federal grant. This is the beginning of our patient's entry into the clinic. As you can see, this is our workup station in which they will have vital signs obtained first. Later they will return back to here, and if there's any lab work that needs to be done, they can have here. We actually at the clinic have a discounted lab rate available through LabCorp, a national lab company, which allows us to offer discounted labs at a much saving cost. We can do a basic CMP, which is usually $50 to $75, it's $5 here. And that's through LabCorp's generosity of being able to donate to our clinic by offering this discounted rate to our patients who are sometimes in drastic need to have a diagnostic test. This is our typical exam room. As you'll see, it's similar to any other, clinic's exam room. If you will notice, as we said, this is a community effort. All the cabinets that are in the clinic were actually donated by Thomas Kennedy and Cavalier Housing. Cavalier Housing was the old Wise Hospital. By donation of these medical grade clinics, it actually amounted to around $75,000 that was able to go into the building of the clinic. This room is actually a procedure room. We do small procedures here in the office, such as skin biopsies. We do joint injections, that type of thing. They, again, are all free of charge. We do ask for a donation and help with cost of supplies from the patients. We have found that by asking our patients to provide just a little bit of donation to help with their care, we have an increase in compliance with medications and with keeping their appointment visits. And the patient actually feels better because they're buying into their health care and they don't feel like they're just taking something. As you can see, this room is not yet put together. This is our future site for our vision services. We have the remote area medical event in Wise County every year. During this event, the dental and vision are the biggest draws, and we're hoping to be able to collaborate with ophthalmologists, hopefully be able to obtain equipment that we can put in here to where patients can come for free eye exams monthly, quarterly, or even twice a year would help. And it's through private donations. VSP, which is Vision Service Provider, has given us vouchers that we can use to purchase eyeglasses. And again, through multiple collaboration and network, we are hoping to be able to bring vision services to the clinic on a monthly, quarterly, or biannual basis. This is our almost ready to go dental room. We hope to be able to recruit some dentists to come in and provide dental care for these patients. We actually have the latest equipment has been donated by the Appalachian Regional Commission grant. It is digital dental equipment. We're going to have x-ray technology available. We're just waiting on the final details and hopefully to get some dentists to volunteer to help us to provide dental care for our patients. At Remote Area Medical, we see so many patients that have went without dental care, because even if they do have insurance, most insurances do not pay for dental, and if you do have dental, it's usually outrageous and they can't afford it. When you see the video that Teresa Gardner is going to be showing, our executive director, pay especially attention to the man in the pickup truck. He actually received a set of dentures. These are services that are available free of charge, and the difference it makes in these patients' life, because your smile is part of your self-esteem. So dental services is another drastically needed service, but it's also something that psychologically and emotionally can open up a whole new world for patients. If you'll notice, it says peace begins with a smile. We also say that inner confidence and self-esteem can begin with your smile. This is again through Mother Teresa, who would be such an example and light to all of us. This is our x-ray equipment. Dr. Joseph Smitty, who is Papa Joe Smitty's son, actually was able to get all of this equipment donated to us. This is digital x-ray equipment. He comes quarterly and holds a pulmonology clinic. With his clinic, he has actually diagnosed aortic aneurysms. He's found lung cancers. It's just such a vital services that people would die, honestly, without the services we have here at the Health Wagon. We save a life weekly, if not daily, because when people are without health insurance, that's when you're your most vulnerable. We also have ultrasound equipment available. Dr. Ross Isaacs, who is a nephrologist, comes down biannually and at our remote area medical and holds nephrology clinics for us for patients with kidney disease. We're hoping to be able to expand our x-ray to be able to include such things as extremities and other areas than just the chest x-ray. We need a radiologist to help us to read this. We're hoping maybe to be able to collaborate with another organization to where we can have a full x-ray service available also. However, right now we are limited to chest x-rays. Okay. This is our diabetic treatment room. We have a high rate of diabetes and hypertension in this area. We are able to provide our patients with a glucose monitor and with glucose testing strips where they can test their blood sugars, also at a discounted rate. We also offer diabetic education as well as education for lipid management and weight loss. This is our doctor's station. It's also where our students stay when they're here doing patient education. We love students here at the Health Wagon. We have very great collaboration with University of Virginia, Appalachian College of Pharmacy, East Tennessee State University, Lincoln Memorial University, VCU and MCV, and students actually rotate through here, and they are a great help to us, and plus they have a great experience. We also have our specialists that come, Dr. Turner, who is a cardiologist, and Dr. Reinhardt, a diabetologist, and this is where they are actually accustomed to being while they're seeing our patients. Dr. Reinhardt comes quarterly, and Dr. Turner comes annually to biannually. And right here is our nurses station where a lot of work goes in. We also have eClinicals, which is electronic medical records that we were able to obtain through a HRSA grant, which has made the transition of patients, the continuity of care, so much improved. Again, our specialty clinic is totally free of charge except for a request for a $10 administrative fee. This is our telehealth room. By telehealth, patients are actually able to come here to our WISE clinic and be examined and evaluated by specialists that are the University of Virginia. This includes psychiatry, gastroenterology, dermatology. They're actually seen live time. It's transmitted live time to the University of Virginia. Our latest endeavor, Teresa and I actually went to the University of Virginia and are trained in colposcopies by Dr. Peyton Taylor being on the other end and us here actually doing the examination. He actually will be guiding us on doing biopsies of the cervical region for patients that may have obtained an abnormal pap smear. We do a lot of screening here at the Health Wagon. However, our philosophy is there is no reason to do a screening if you're not going to follow up on it. So if a patient has an abnormal mammogram or an abnormal pap smear, we always make sure that they're able to get in, and we try to do the referrals and everything to get them the best treatment that they possibly can have. We've also recently started a colostomy clinic with the University of Virginia. Patients that actually receive a colostomy in Charlottesville can come back here for their 1-month follow-up if they're having complications or if they may need a bag refitting. Our nurses have been trained, and as I said, they are connected right to specialty services. They see exactly what's needed, and they assist us in the treatment plan that we then develop. This is, we actually, at last count, we were doing more telemedicine consults than any other clinic in the state of Virginia. As we are looking at getting a new mobile clinic, we are wanting to be able to allow our patients to have access to this on the bus. I'm not sure if we'll be able to set that up due to the mountainous regions, but we would like to be able to offer it also on the bus. However, if not, it is stationary here at Clintwood and at Wise. Down this hallway are administrative offices and also our sample pharmacy closet. This has allowed us to be able to have actually office space. If not for Shannon Scott and Carl Snodgrass and Dr. Smitty and the community that outreached for us, we would not be able to have this clinic, and we're so appreciative because it's a service that we're offering to our patients of this region. We're the only free clinic within our service area. Here we have a couple more administrative offices. We've been blessed to have Adam Horn. He's our IT specialist, and he has helped us get our electronic health records, as well as keeps our servers and everything up and going for us. This is our conference room. We also have educational programs in here. If you look at the furniture in here, this was actually donated by Dr. Joseph Smitty, who also gave us the picture on the wall of the coal miner. The television on the wall was donated by Crutchfield for us. And this is our reception area and our registration office. Again, we feel so blessed to be able to provide this clinic, and it has given us so much office space. And if you had seen where we started out in Clinchco, you would see how far we have came. And this is just from everyone's opening up their heart and having the generosity to make sure that we were able to bring this to the citizens of Wise, Dixon, Lee, Buchanan, and Russell County. And Scott County. We're now in Scott County also. As we come to the end of our tour, you'll see this is what the last thing that our patient sees. God be with you till we meet again. We try to give an inspirational thought all the way through the clinic and also to our patients, just to let them know that we do care and that God cares.
And as everyone has a seat or prepares to take your seat, please, I would like to ask Teresa and Paula. Paula, would you come up and join me beside of Teresa for just a moment, please? Because I cannot answer any questions that you might have, but we're going to attempt to do that. Do you have any questions that have been generated by what has been said today or the film that you saw? Are there any questions? No one has any questions, please? We do.
This is from UVA. So, you all just have a partnership? I mean, can you explain a little bit about that?
One of the best things about the Health Wagon is, I think it's more Teresa. She is really good at negotiating. She is really good at negotiating. I don't need one, Shannon. Let's not. She is really good at negotiating and collaborating. We have a lot of collaborative partnerships with, like I said, the University of Virginia, Appalachian College of Pharmacy, and through those partnerships, that's how this has developed and how it's expanded, and just knowing the right, contacts and networking, and it's a lot of time, but it has been such a tremendous help, and we're constantly looking for more contacts out there. And I tell Teresa, we say all the time, we're really good at begging. So that's really what we do. We can look pitiful really easily because we do have a story to tell, because there's a lot of our patients in desperate need. So we're really good at asking for it.
And we have a wonderful partnership with the University of Virginia Health Systems at Charlottesville. They are phenomenal. I mean, they do a quarterly digital mammography clinic for us here. Unfortunately, we probably pick up like a breast cancer almost about every time that we do it. They come to our RAM outreaches. They've been traditionally very supportive of that. And and with the telemedicine, it is incredible. We do more telemedicine than anybody in the state of Virginia. We use it a lot for psychology, dermatology, and other specialty services. And what's really good about it is if the patient does not have insurance, it rolls over to an Anthem grant, so it's all free of charge for our patients. We just had our first ostomy clinic. When the patients has to have an ostomy, instead of like traveling back to UVA Charlottesville, they can come here at our clinic and have that done. That was, as far as we know, it's the first in the nation. We had that last month. And then Paula and I have been trained on colposcopy when the women have like an abnormal pap smear. And so we will be doing our first colposcopy clinic. Dr. Cantrell's already been involved in that for a little bit, but we'll be the first colposcopy clinic here at the Health Wagon as well. So, and they've been so wonderful. They paid for all of our training for Paula and I to go up and be trained with some of the best physicians. It's a wonderful, wonderful partnership.
So how long, I got in like, how long has this, you been in this building?
We've been in here since a little bit over a year, yeah.
January 2012.
Yeah, yeah. And we've got, I mean, and I think what Paul was talking about, I mean, we have to just find the resources for the patients and try to plug them into the clinic. We're always looking, to network and find, just positive relationships. And Mountain States has been a wonderful partner as well. We can't say enough about them as well. So we have just so many wonderful partners. There's probably about, when we have the RAM event, there's probably about over 200 organizations that come and help at that. So we just feel that the collaboration is just unprecedented. I mean, and we attribute that to God. I mean, God just blesses us with lots of wonderful people, puts a lot of wonderful people in our paths.
Teresa and Paula, if I may add, one person whose name was mentioned today, but you did not necessarily see on the film, and that would have been probably his preference. That was Dr. Joe Frank Smitty.
Mm-hmm.
All of you, most of you are familiar with Dr. Joe Smitty, our first chancellor of the University of Virginia's College at Wise. But Dr. Joe Frank has been here since day one. Dr. Joe Frank went on to a dealership lot several years ago. The salesman came out and asked him what he was looking for, and he was looking for a tractor to pull his X-ray trailer. After finding out what it was that he was going to do with that trailer, the dealership gave him the tractor. And Dr. Joe Frank drives that tractor to Wise, Virginia every year, and throughout the year he drives it from place to place, from Kingsport to Dickinson County and other places.
Buchanan County.
So we have a number of people who are doing their part. We have time for one more question if there's another question. So if there are no other questions, the essence of tonight is to showcase that so many are doing their part. And really, everyone has the opportunity to say, what is it that what is it that you might be able to do to make sure that facilities such as this are made available to those who are not as fortunate as you might be. We never know from day to day where we're going to find ourselves. Now, if you would bear with me and bear with us just for one more note, you're going to be contacted by a member of the staff sometime possibly next week, and you left your contact information here, and they're going to ask you to participate in answering 6 questions. Questions about what you thought about today and how the comments made today impacted you. So please do respond to that questionnaire when you get those calls. And if there are no other comments, ladies, we're going to thank everyone so very much for coming. Thank you for your participation. Your participation here tonight, your presence here tonight shows that you care. Spread the word, tell others, and let's wish RAM, let's wish the Health Wagon many, many, many years of wonderful success. Thank you so much for coming.
Thank y'all for coming.